this is Kerry Hall, America's Healthcare Advocate. We're having an ongoing discussion today with Dr. Kelly Logan about the uses of medical marijuana. So what we're trying to do here is educate the audience. You heard Doctor say in a previous video, this is not about recreational use or getting high. This is about treating chronic illness and chronic disease. So we're going to talk about two issues here. We're going to talk about arthritis, and then we're going to talk about digestive issues like ulcerative colitis, Crohn's, and irritable bowel. So doctor, let's start with the arthritis issue, and we talk about mixing CBD and THC. Can you define what that is and how that works?
Absolutely. So one of the things I really like is when you get into the medicinal side, you can do different combinations of CBD and THC, and they have different properties. When you're talking about something more inflammatory, like ulcerative colitis, then we want to calm down the spasms. We want to calm down the inflammation. So there might be more CBD in there, but then there's also some THC in there for the pain. And so that is where it really gets kind of technical and fun for us that are looking at really killing two birds with one stone, right? So when you're taking multiple medications for ulcerative colitis, right, you have an acute flare or you always have something going on. So there might be a day where you have a flare going on and you do something that's more anti-inflammatory and you do something that's more pain controlling. And so it is this nice combination between this plant, right, that in the right ratios. And that's what's really great when you get a good dispensary and you get really good people that understand the plant. You can get, okay, we might need more anti-inflammatory here and a little bit less pain control, but we might need more pain control and less anti-inflammatory.
Depending on the situation.
Depending on the situation, depending on the diagnosis, depending on the patient.
If you contrast this with taking prednisone, which is a typical prescription steroid that's prescribed for ulcerative colitis, Crohn's, irritable bowel, this is a big difference, and it does not have the debilitating side effects
of steroids.
Steroids are very harmful.
Very harmful long term. And so in something like ulcerative colitis, when you do have to do a burst and taper of steroid, right, you do that long term, then we're getting into other side effects of that.
Yeah, osteoporosis, all kinds of other
fractures,
issues.
All of these different things, and you have to really be careful about how you do that. When you're doing plant-based medicine, it's really more natural, right? So we're not dealing with those side effects. We're dealing with, that's the way the plant works. The plant works as an anti-inflammatory. And if you increase the anti-inflammatory portions and decrease the psychedelic or high portions of it, you can get a really great mix.
There you have it, ladies and gentlemen. That's Dr. Kelly Logan. She certainly knows what she's talking about. Thank you for listening here on America's Healthcare Advocate.